Unfortunately, once again, I'm here with a depressing but important reminder that the coronavirus pandemic is not over yet. Cases, hospitalizations, and yes, deaths as well in the United States have been rising at an alarming rate. And that was before this Memorial Day holiday weekend. In fact, according to the New York Times, both COVID hospitalizations and deaths have increased by about 20% over the past 14 days. And we're averaging now 100,000 new cases a day. That's a conservative number because most people are testing at home and not counting those tests. These numbers aren't as high as they were at the peak of the Omicron surge back in January, but it's still about a 14% rise in the last 2 weeks, and 5 times the number of cases we had last Memorial Day, 2021. Current diagnoses aren't the only thing to worry about either. According to a new study by the CDC, the long-term effects of COVID are serious and widespread. COVID survivors are twice as likely to develop respiratory conditions, and 1 in 5, yes, 20% of survivors aged 18 to 64 develop long COVID symptoms, which range from neurological to cardiovascular conditions and more. The risk is even higher in the elderly, with 1 in 4 survivors over 65 developing such symptoms. But despite what the stats tell us, many people are ready to move on and quick to pretend that everything's back to normal and COVID isn't that bad anymore. And no, I'm not just talking about Fox. David Leonard of the New York Times, for example, is back this week with an op-ed against mask mandates. Leonard, very influential journalist, claims that mandates are not sustainable because masks are uncomfortable and they fog up glasses. Yeah, they fog up glasses. He knocks mandates for being divisive and suggests a less controversial measure like more booster shots. Last time I checked, COVID vaccinations were just as politically divisive, if not more so, than mask wearing. And also, we can't just give up on public health measures because the right has successfully politicized and polarized with them. Leonard, like so many in our media, still frustratingly ignores the issue of long COVID too, and downplays the severity of COVID in kids too young to be vaccinated, calling it overwhelmingly mild. Tell that to the parents of the more than 400 kids up to the age of 4 who've died from COVID since the start of the pandemic. Now, let's get the latest on this current, call it a surge? I think it's a surge. From MSNBC medical contributor Dr. Uche Blackstock, who is an emergency medicine physician in New York and founder and CEO of Advancing Health Equity. Dr. Blackstock, welcome back to the show. What is your top-line reaction to these latest rising COVID numbers? What do you think is causing this latest surge?
Well, first, I'll say thank you so much for having me on, Mehdi. And second, when I woke up this morning and I read that headline from David's column, I just got this horrible feeling in my gut because, as you said, the numbers are going up, hospitalizations and deaths. And we still are very much in the middle of a surge. However, we're getting all of this messaging that the pandemic is over. And we're even getting people who are privileged with huge platforms like David, yes, putting out essentially misinformation about the efficacy of masks and mask mandates. And I would say that it's incredibly dangerous what he's doing. He's minimizing the complications of COVID, and he's minimizing the effectiveness of masks and mask mandates. And it's incredibly disappointing that he's continuously being given that platform by the New York Times leadership.
And just briefly on the numbers themselves, what do you think is driving the rise in numbers?
Oh, I think that the drive-in numbers is for multiple reasons. Yes, we do have a more contagious subvariant. The BA2 subvariants are highly contagious. But the fact is that we no longer have any public health measures in place at a community level or at a population level to prevent transmission. And the fact is that while one-way masking does have some efficacy, it's universal masking that is most effective. We no longer have vaccine requirements. We no longer have capacity restrictions. Look, I know people want to get back to life as normal. The fact is we're never going back to that. Normal does not exist anymore, right? There's a new normal. And the fact is that we need to be advocating for harm reduction. And what does harm reduction look like? It looks like multi-layered strategies.
And when you talk about harm reduction, we define harm as hospitalizations and deaths. And yet the CDC just came out with a new report that 1 in 5 COVID survivors will have symptoms of long COVID. I feel like it's the most frustratingly under-discussed part of this pandemic. We talk about COVID only in terms of hospitalizations and deaths and ignore the millions of people who got mild cases of COVID but are still suffering the after effects months later.
Yeah, no, Mehdi, you're absolutely right. Long COVID has been ignored, I think, because initially the biomedical model could not really explain the symptoms. And we really haven't done the research that we've needed to do on long COVID. But we know that it's here, and we know that we need therapeutic and interventions for it.
So how do you respond to David Leonard's assertion in the Times that COVID has been, quote, overwhelmingly mild for young children, given the number of hospitalizations that went up during Omicron, specifically of children, and the overall number of deaths of kids? Why this constant attempt to pretend that kids are, even now, even after Omicron, to still say that COVID doesn't affect kids is just madness, is it not?
Right. Yeah. It was it was in the top 10 causes of death for children in 2021. And of all respiratory viruses, even compared to the flu, it had caused more deaths than the flu. So we can't even compare, comparing the flu and COVID is like comparing, apples and oranges. You cannot compare them at all. And we're seeing, especially most of these deaths are occurring among the unvaccinated. And so, to say that it's mild is really such an insult and incredibly harmful to the families that have lost children from this. The fact is that children should not die. Right? Children should not die. And even the numbers that we're seeing children die in are high. I mean, to have COVID in the top 10 cause of death, that is incredibly significant. And then to know that there are preventable strategies in place to prevent those numbers is unconscionable.
The really unconscionable sleight of hand is when people say, well, kids, it's mild in kids because kids don't die at the same rates as older people, which is a ridiculous comparison. On that basis, cancer is fine in kids too, because kids are less likely to die of cancer than older people. It's a ridiculous argument. I see it as a sleight of hand. But we get this minimization again and again. Even with the Omicron variant, we were told, not just by David Leonard, but by plenty of people, that it's milder than Delta. And yet, in some states, we now know Omicron caused more deaths than Delta did. There is no reason, is there, Dr. Blackstock, that the next variant after Omicron is going to be less contagious or less deadly? It could very well be more contagious and more deadly. We just don't know.
Absolutely. And we have some data that BA4 and BA5 subvariants may not only be as contagious, but more pathogenic, more deadly. So the fact is that we still do need those public health measures in place, because while overall it may be mild in terms of hospitalizations or death rates, the fact that it's so contagious, we need those public health measures to decrease transmission. And those public health measures have been pulled back and not reinstated. And that is the danger.